Well, today, Governor Mike DeWine said he plans to fight racism on another front by taking steps to confront health inequities. News 5's Olivia Fecto explains how the pandemic has emphasized the need for that change.
Governor DeWine said the pandemic has made those disparities even more obvious. From health conditions to law enforcement to mental health services, he says Ohio needs to change.
We should all be outraged that in the year 2020 in Ohio and in this country, there's still inequality of opportunity and there is still racism.
Governor Mike DeWine said Ohioans have a moral obligation to make sure everyone has the same opportunities. He touched on a number of issues that disproportionately affect Black and brown Ohioans, from infant and maternal mortality to educational inequality and implicit bias in law enforcement. He said it's not only about race, but other ways in which people are marginalized, too.
We still have too many Ohioans who are living in the shadows of opportunity.
The disparities we're seeing are actually just showing flaws in our existing system.
Policy Matters Ohio senior researcher Amanda Woodrum says those flaws are exacerbating pre-existing disparities.
I think the bottom line is being poor is bad for your health, and so is racism.
Woodrum says those two issues need to be tackled through policy changes, adding that Black Ohioans are more likely to live in poverty than white Ohioans. All of this contributes to a disproportionate impact when it comes to COVID-19 and other health and economic conditions. She thinks the governor's minority health strike force will help by allowing lawmakers to hear the experiences of minority Ohioans.
But we have to pay attention, and we have to hold people's feet to the fire to make it happen.
Historically, she says that's been an uphill battle, but this moment in time may help change that.
We need to take advantage of that moment and do something now.
The governor also said he plans to continue working to address lead paint poisoning in Ohio's children and getting mental health services into Ohio's schools for kids who need them. Olivia Fecto, News 5.